is Jennifer, and I am a UNO clinical mental health counseling student who's here to talk to you today about anxiety. So, I'm going to share two myths, three facts, and an evidence based tip to get you started managing your anxiety today, as well as a resource where you can learn more information. So, let's get started. Anxiety disorders are common but serious medical conditions that interfere with someone's everyday function by causing them to feel excessive fear and worry. So, there are a couple myths about anxiety that need to be debunked. First is that if you're experiencing anxiety, you should avoid stressors. Now, while this may seem like good advice, it's actually something that's more likely to increase your anxiety. If you continue to avoid everything that you enjoy that also may have some stress associated with it, you're more likely to isolate, increase your experiences of anxiety, and then cut yourself off from things that you derive meaning from. A second myth is that medication is the only treatment for anxiety. Now, while medication can help with symptoms of anxiety and may be appropriate in severe cases, it's not the only way to treat anxiety. There are several evidence-based therapies and treatments that can help you that have nothing to do with medication. Now, getting into our facts about anxiety, first, anxiety is actually a very normal human experience. Everybody has anxiety, and it serves an important function of letting us know when there are things in our environment that we should pay a little bit more attention to. However, when it becomes a clinical level of anxiety, usually it's interfering with that person's day to day function. Second, anxiety disorders are actually quite common. About 19% of adults experience an anxiety disorder at some point in their life, and up to 32% of adolescents as well. Now, third, anxiety is actually very treatable, even though many people with the disorder do not seek help for it. So there's many options out there, including therapy, and you might learn techniques like meditation or getting exposure therapy to the things that you're afraid of, as well as medication that can help in some cases, and exercise. So, I'm going to leave you today with an evidence based tip of something you can start doing now to manage your anxiety. According to a systemic review, there are three practices that are helpful in managing anxiety. That includes regular exercise, mindfulness based activities, as well as yoga. So, if you feel like you are somebody who is struggling with anxiety and want to learn more information, I will leave you with a link to the Anxiety and Depression Association of America. So, that's where you can find out more information about anxiety as well as depression and find a therapist in your area who might be able to help.